All right, we are live. Welcome everybody. This is kind of a cool opportunity we have today with the leadership team down at the Department of Human Services. I'm going to go ahead and introduce everybody real quick. And if you guys could just wave your hand when I don't have names on the screen or anything, but just wave your hand at me when I kind of name you off. So we've got Tracy Garcher, who's the director of the Department of Human Services with us. We've also got Barbara Golden, who is the Finance and Operations Director. We've got Joe Kellerby, who is the Child Welfare and Adult Protections Division Director. We've got Curtis Engelhart, who is the Workforce Center Director. We've got Michelle Trujillo, who is the Economic Assistance Division Director. And we've also got Katie Miller, who is the Public Information Officer. So guys, welcome today. Thank you for joining me on this live call. And I'm gonna give Tracy about 30 seconds to kind of introduce your side of it.
Sure. Thank you, Cody, very much. So we can't have a good government gathering without a disclaimer. So no secret that you're a candidate for county commissioner. We want to acknowledge that. We also, for anybody watching this either live or later on, we just want you guys to know that the Department of Human Services, either formally, individually, or collectively, we are not endorsing Cody as a commissioner candidate. Because we can't legally, and we wouldn't do that. What we can do is we can sit down with anybody that is a candidate running for any office, or really anybody in the community that wants to know and learn and understand more about our programs, and have these types of conversations with them. What our main goal is today, that this is affording us, is to really educate the community and then that person approaching us on what we do and why we do it. So with that, welcome, Cody. We appreciate you approaching us and giving us the opportunity to answer some questions that you have about the Department of Human Services, that I think the way, if I understand it, you kind of described, maybe this will help the community understand what we do as well. So thank you.
Yeah, absolutely. And from 13,000 feet, I think people would like to know kind of what DHS does, and more specifically right now, how is the Department of Human Services affected, one, by COVID, and two, by the shutdown, because the two are kind of separate things. And so I've got some specific questions I'd like to ask each of you today, and you guys can chime in as you feel or as you see need. So, but first of all, first question I have is, Tracy, as the director, broadly, what services do you guys provide, and how have these services been affected by the stay-at-home order?
Sure. So we are still providing all of our mandated services. So at a high level, those are protection services. So as Joe mentioned, child protection, adult protection. We also have our full gamut of public assistance. So mainly food assistance, as well as medical coverage, which is Medicaid. And then we also have our broad arrangement of workforce center support services. So really, from a service perspective, we're doing everything. What has really changed is how the public can interact with us. We are a heavy person-to-person contact service delivery system. So whenever you put you essentially lock the front doors, that created our biggest issue. So that's what we're trying to do now. And what I would encourage everybody to do is just simply go to our website, which is humanservices.mesacounty.us. That is humanservices.mesacounty.us, or our main phone number, which is 970-241-8480. So that's 970-241-8480. And we will get you in touch of who you need to be in touch with, or how to contact us.
Cool, thanks, Tracy. So you guys are a really hands-on organization. It's not like you guys just do everything in the office. We're foster parents. You guys are out in our home usually once a month. You guys are very hands-on, and so you're going to have both health and legal hurdles through both the stay-at-home order and the COVID stuff. So how have you guys adapted? How are you adapting? And how do you see issues and hurdles that you guys can come over in the future?
Yeah, thank you for that. So the stay-at-home order has impacted us. Obviously, we're a critical, essential function. What we've tried to do is really, at a high level, two big things. One is to keep the outside out. So that is our case managers, our in the field folks, the ones that are working with you, Cody, and or other foster parents, medical providers, things like that, out in the office or out of the office, so that they're not bringing COVID if they come into contact back in the office. So it's not only to keep the folks we're working with safe, so all of you guys, but it's also to keep our workers safe as well. Then we're working really hard to keep the inside in, which is those workers that can't work efficiently or effectively from home. So that's a large part of our public assistance workers. So we still have the same legal mandates. There's been a few things that have relaxed, but what we're trying to do is, because it's changing almost on a daily basis. Again, if folks will go to our website, we've got a good page where we're keeping all of our most recent changes. I know in Joe, and he'll probably touch base on some big ones, some changes in his world. Michelle's got some relaxes or some rules that have been relaxed on eligibility, just so we're not stockpiling people up in wait lines. But that's how it's impacted us the most, is how do we work the safest and the most efficiently with the public and with our workforce.
Very cool. So, and this one's probably more directed towards Joe and Michelle, so that you guys kind of chime in each, but the stay-at-home order is undoubtedly going to cause some of the most stressful times that we've seen in a while on the family units, because they're at home, they're told to stay at home unless they're going out to buy groceries and do those vital functions. But isolation seems to be a key factor in drug abuse, drug usage, addiction. I imagine DHS has not been seeing the impacts quite yet, but what does the leadership team anticipate to be the result of such policies and the response to the need of your services, particularly for child protection or family supports?
Yeah, so I can field this. This is Joe Kellerby, Division Director for Child Welfare and Adult Protection. We are definitely certainly aware of all the additional stresses that the stay-at-home order is going to bring. And Cody, you're right. We haven't seen the impact of that quite a bit. What we are already in both leadership teams discussing kind of what we're talking about is the avalanche of need when this thing breaks open. And so we're talking with our service providers about what kind of capacity they look like. Our leadership team is already talking with their staff about what that might look like and things to look for. So certainly the most obvious is if a child or a family member of a at-risk adult or children or youth just let us know what's going on. That's going to be pretty easy. It's the overt kind of the hiding of a family situation that makes both those populations becoming more at risk and becoming abused and neglected. And so we're already having some of those conversations. There's lots and lots of work going on nationally about this topic, and we're certainly following some of the research and some of the articles from a lot of national experts to get us prepared for some of those things. But you've hit the nail on the head with our concern of lots of isolation and what that can do within families.
Cool. And I've actually got a follow-up question for you, Joe. But Michelle, I want you to address maybe accessing basic needs that COVID and the stay-at-home crisis kind of presents.
Yeah, sure. So obviously, folks not being able to come into our office does create a barrier for access to our programs. And so what we've been trying to do is get the word out to make sure that those in the community who have a need understand the different avenues that they can use to apply for assistance with us, whether it's online or asking for applications to be mailed, picking one up from a box outside of our door, that type of thing. So just trying to create awareness about accessibility. And then the state has been doing a bang-up job of applying for certain waivers to ease access to our programs, and then also allow us to better utilize our resources in-house so that we could be more responsive to folks in the community in need. A lot of people are out of work right now, and they're going to be going through some hard times, and these programs are here to provide that safety net when it's needed. So we want to make sure that we can get them help as quickly as possible.
So just as a follow-up, Michelle, you guys obviously live in a highly regulatory environment. Have some of those laws, regulations, they're being more flexible with you guys now?
Yeah, exactly. So for example, the SNAP program, which is the Supplemental Nutrition Assistance Program or food assistance, for the month of April, we're not required to do full interviews with individuals.
Okay.
And for individuals that apply and are found eligible for the month of April, we'll be issuing the maximum benefit for their household size, which is wonderful. So there have been several accommodations made like that based on waivers that the state's applied for to help folks out.
Very, very cool. Hey, Joe, a follow-up question to earlier, and if any of you guys want to jump on it, you can, but I know statistics show a sharp increase in child abuse when the economy turns down, and we saw that evidenced in 2008, back in the downturn then. Child abuse also increases when kids are at home in stressful environments for long periods of time. And finally, when kids are not in school or in their churches or in their community activities, no one can see or report this type of potential child abuse. So the stay-at-home order, kind of in a perfect storm scenario, is producing a lot of economic uncertainty, and kids are essentially required to stay at home with parents. Does this scenario concern you? What can the community do to help in this scenario? Because I know it's the community a lot of times that sees child abuse, and there's the ones that call it in, you know, from childcare to schools to churches. To the people who are involved in these kids' life. Sometimes that's the only time they see anything in the outside world, and those community people within the community can help them out. So what kind of scenario does that, or rather not scenario, but what kind of obstacle does that provide for you guys?
Well, yeah, it's a big obstacle. I mean, we right now get the concerns from what you just talked about, mandated reporters, and a large piece of mandated reporting comes from teachers. So we have spoke with several administrators and teachers in regards to what it might look like to identify abuse and neglect through a mobile platform, looking at surroundings behind them in regards to the environment, how parents are acting, and certainly talking about any major changes in behavior that they're seeing with their students. So we've got some of that information out there. And you're right, Cody, it is a perfect storm in regards to the call volume. We are generally seeing a downtrend in our call volume, which was absolutely anticipated. Although interesting enough, yesterday, when we were averaging around 10 to 12 calls a day, yesterday got back into the mid to high 20s. And so we blips on the radar, which are kind of nice to see in regards to people still reporting out some concerns. And we're just trying to be very public about the supports that parents do have. So the school district has done a lot, sending emails from counselors and administrators right to parents about the support that they've got. Hilltop has started a parent support line. Mind Springs is fully operational for telehealth. And folks can still call the child protection hotline at 970-242-1211 and still ask for family-based type services. And we are fully operational to do that per regulations over a mobile platform.
So, Joe, so understand kind of from that perspective what people can do, what they can call in. Is there something we can do that doesn't involve necessarily Department of Human Services reaching out to people, engaging with people we haven't seen in a long time? Is there something kind of on that side of the line that we can do, or the community can do, to help engage people still? Because I think it's that lack of engagement where a lot of these problems start.
Yeah, I think the idea of continuing to build social capital still remains. It's just how creative are we going to be able to do that? So businesses have moved what we're doing right now. Everything is mobile and online, potentially helping people to get to that point, and helping people understand how they can connect online, how you can do mobile check-ins like what we're doing right now, just to stay involved as much as you can and ultimately continue to have eyes in the home. I think being able to have standard check-ins as well. So it's something that people look forward to and kids look forward to, and trying to build some of that structure that families really need, that they can look forward to and build on day after day.
So what do you mean by standard check-ins?
Yeah, so kids, what we have seen is families do pretty well when there's structure. And so one thing that we're worried about is with the online schooling is it's not as much structure for kids, and that can increase stress. So if you are somebody that is worried about a family or needs to stay connected, build times that you're going to call or do a video chat. Build those times in every week so it's something that families can look forward to.
Okay, Joe, thank you.
And Cody, this is Tracy, and what I would add to that, and this is my personal opinion on that. I think now more than ever is whenever we need to rely on friends and family to keep eyes on folks and offer those supports. But I think one of the driving reasons why you brought this topic up to us is just the challenge that this stay-at-home and social distancing has added to our circumstances today that just didn't exist in the past. I know one of the things we used to say is we'd ask people, do you know all the names of all the kids on your block? Mm-hmm. Right? And right now, I bet there's not that many folks who do. So it creates a challenge to walk down to your neighbor's house and knock on the door now with the social distancing. So like Joe said, just please, if you have concerns, call us. We're working on a list, and it'll be published on our Facebook and our website very, very soon about all the different resources. Some involve us, but a lot don't, for folks that have those legitimate concerns out there. However you can get help if you need it, please seek it out. We would rather help you now than have to help you later.
Correct. And I think that's kind of the premise of this whole thing is sometimes I think we get a little myopic and we're all focused solely on COVID and the stay-at-home order and not spreading this, which is good. But sometimes I think we lose focus of the unintended consequences of a stay-at-home order. And that's obviously what I wanted to talk about today. So obviously your departments are heavily funded, not by the county, but by state and federal pass-through income. And have your guys' funding sources been compromised yet by COVID-19? And if not yet, do you expect them to be? I think this is probably a better question for Barbara.
Yep, this is Barbara Golden, the Division Director for Fiscal Operations and Quality Assurance. And thanks, Cody. No, we haven't seen any effect of that, and I don't expect to. What we have seen is similar to what Michelle said, and really the ability to be more flexible with our funding in order to meet those community needs. Some examples of that: when the governor declared the state of emergency, we were able to open up our TANF emergency policy, which means now we can use our TANF reserves in order to assist those folks who are eligible and who have been directly affected by COVID-19. Those reserves are things that we've built up over the years by being fiscally responsible and kind of waiting for something like this to happen. One of the other things, I was on a call yesterday, we were able to be more flexible with our childcare dollars and really help preserve those resources in the community with our childcare providers by opening up how many absent days we paid to them. And then on the flip side, also helping those families that still have to go to work but now have kids at home and need all-day daycare, and helping with the parental fees. And the state was actually appropriated some additional CCDF or childcare development funds for that, so that counties were held fiscally harmless. So I really think overall, I would say we're in a good place fiscally to be able to help stabilize those in need in our community.
So those TANF funds, get into those just a little bit. They're built up by the Department of Human Services as kind of a rainy day fund for
Correct.
Events like this.
Yep, correct. And we can use them. I mean, we kind of look at the needs of the year, the budget year that we're looking at, and what do we need in the community, and then how much do we need to save? And it's kind of a balance every year when we look at that. The state also has some of those TANF reserves, and if we see a large need across the state, I would imagine they'll open up some of those state reserves as well.
So these TANF reserves are for people who are affected by COVID. Does it? Are we talking about businesses that are affected by COVID or individuals that are affected by COVID?
No, these are individuals. So these would be individuals with children in the homes, and they have to make under $75,000 household income. And then it's kind of the payer of last resort. So it's not there to replace, say, unemployment. So if somebody has lost their job due to COVID, it's not there to pay for unemployment, but maybe there's some immediate needs. Maybe there's housing immediate needs where they can't pay their lease for that month because of something that's happened with COVID. So okay. It's things like that.
Okay, great. Thank you. Curtis, Curtis is the director of the Workforce Center. Got a question for you, man. What does the Workforce Center do in general? And have you guys had to tailor your response to this shutdown due to COVID?
Yeah, thanks, Cody. So Curtis Engelhardt, director of the Mesa County Workforce Center, and we have had to tailor our services. So we're still operating all of our services. It's just through a different fashion, and it's through that virtual platform. I'm doing a lot of meetings similar to these Zoom type meetings or Google Hangouts, but still trying to get our employment services team out there to really assist individuals as well as businesses who have laid off or have to lay off due to COVID-19. But really what the Workforce Center does is all about meaningful employment. And we really try and get people stable through some of our human services programs, and then get them job ready through what's called career development, where we can pay for occupational skills trainings and get them into what's called a work-based learning, which would be an internship or an on-the-job training opportunity. And then our employment services team is directly responsible for connecting local talent to local employers. So we run a lot of different programs through the Workforce Center, and we're considered a one-stop shop comprehensive model. And again, all those services are still available. We're just doing it through a virtual platform. And a couple things I would add, Cody, is if you are somebody who has been recently laid off, or if you're an employer who is laying off, we have a lot of services that are available to you, and we want to be able to talk to you about that. And so you can actually set up a phone interview with one of our employment services team members by dialing 248-7560. And then we're also continuing to keep tabs on all of the new jobs that are available locally. And we've set up a job hotline for that. And that's updated every single morning, Monday through Friday. And it's an automated message with those new jobs. And that's 248-7575. So those are some of the ways that we're really adapting to COVID-19. And again, we're continuing to provide all of our services. It's just through that virtual platform.
Yeah, and I understand many of these services probably haven't been affected yet. And you guys might see the avalanche later. So I understand this is kind of, you guys are kind of shooting from the hip in terms of how to respond to this, but I appreciate you guys' engagement. Katie, I did want to ask you one question. As the public information officer, how has the nature of how you get information out to people changed? I mean, obviously you guys were probably pretty digital to begin with, but even more so now, the need to be digital and get that information out to the public.
Absolutely, it's changed 100%. I mean, we have obviously we have a Facebook and a Twitter account, but we've done a few Facebook Lives like this. It's, in keeping that social distancing. Michelle and I actually just did one this past Friday. But what's also changed is how I've interacted with the media. It's been one of those things that, they used to come down to the building. We do an interview in front of the building. Well, that's completely changed now. We've had to set up like with this, a couple of Zoom interviews. I know Joe has done one as well as Curtis. And so the entire landscape has kind of moved away from what we're used to with that face-to-face and really just gone more digital. And it's just getting that message out there. It's like what Tracy and Joe has said, we've got so much information that we're putting out there, and we want everyone to have access to it. And so, and Michelle mentioned it as well, it's just making sure that all of the citizens out there know what's available to them, and that we are absolutely 100% still operational and here for them.
Awesome. Thank you.
You bet. Thank you.
Guys, thank you for jumping in today. Do any of you guys want to add anything to any of that?
Yeah,
Tracy?
Cody.
Or Joe, go ahead.
Yeah, this is Joe Kellerby. Sorry, Tracy.
Sorry.
I just want to assure the residents here in Mesa County, although there's a lot of mobile technology being used in regards to new allegations of abuse and neglect, we are still responding with a face-to-face response. We feel that there really is no good way to assess for child safety through a mobile platform. So we're still responding. We certainly have protocols and procedures on the questions we're asking before we enter a home, and getting guidance from some local and state leaders if we do come across somebody that is either presumptive positive or has the symptoms of COVID-19. So we're taking all those precautions, as well as the adult protection world. And so that sometimes gets lost, but we are still responding at times with face-to-face interviews of any alleged victims of our at-risk adults in the community. And that hotline is still fully functioning as well, 24 hours a day, 7 days a week. And that number is 970-248-2888. Thank you.
Thanks,
Yeah,
Joe.
Thanks, Joe. And what I would add, Cody, is again, I want to thank you for reaching out to us, giving us this platform. This has really changed, I think, for me. My learning curve is almost straight up at this point, but we're figuring it out. We're trying to balance that. How do we stay connected with how can you not use these tools as an excuse not to get together, which is what we're concerned with. And I would look our community in the eye and just tell them that we are here to help. That is the sole reason for our department. This is why we train, or for moments like this. And we all have families, right? We have friends, families, neighbors that are being impacted by their businesses being shut down and not being able to sell. I've got essentially 3 adult daughters home from college, so this is a whole new experience for me. And you just wait until they come back. Wow, yeah. Right? So, and then Joe's got kiddos that in grade school and trying to teach them just like you are, Cody. So we're people. We are your neighbors and part of this community. We're here to help. So just come in and if you need something, if we can't provide it, we will work just as hard to help you find that in the community. Nobody needs to feel like they're doing this alone.
Absolutely. Thanks, Tracy. And thank all of you guys. I mean, I think greatness and leadership shows in the way we adapt to circumstances like this. And I think you guys are doing a great job. And I just say, keep it up. And again, thank you for meeting with me today. I know it's kind of out of the box, but we're living outside the box right now. So again, thank you, and wish you guys the best today, and stay safe out there. So,
all right. Thank you.
Thanks, guys.
Thanks.